I remember the Potter building as being very old.
How can I describe it now?
The big thing about Potter building was it was little.
I can describe it as
all of us who'd been here and been in Potter realized what an antiquated facility it was.
antiquated. I think I can use that word there.
I remember working there while I was in high school. I was secretary at the nurses station, and just remembering it at that time being very old.
I remember having isolation being a piece of tape on the floor. We did have an isolation room, but sometimes we needed 2 spots.
In Potter, I think there was 15 kids to 1 bathroom.
I worked on Potter 1 for 19 years, and we had 1 toilet seat, 1 bathroom for 19 teenagers.
Many of the rooms were double rooms, or we even had some bigger rooms all the way at the end of the hallway that I think actually had 4 beds in them at one point. So patient comfort, family comfort, any kind of confidentiality was a major problem.
So it really was exciting to move to a brand new hospital. You know, one that we had all been part of planning. We had parent groups, we had nurses groups, we had physician groups, and we all got together to plan what we wanted for our children's hospital.
We had to do a lot of preparation. It was like a military operation, you know, what kids are gonna come first, who's gonna take the kids.
At the time, we had an individual by the name of Beverly Babin, who was the director of unit services at the time, and she was there with her clipboard like a coach.
She made sure that we did everything safely, and the parents were involved. They came with us.
The move's gonna go very smoothly. Bev's in charge, she's got her bullhorn, she's all set.
That morning, we actually had so many volunteers. I remember one of the units calling and saying, "Stop sending the volunteers."
There was a huge snowstorm that came on a Friday night, so many people actually stayed in their office on the floor.
My assistant clinical manager and I had to spend the night in the PICU, so we got to experience exactly what it would be like to spend the night there.
And it made the day even more magical because everything was white and the snow was deep.
Bye, Potter!
I stayed over, I stayed in the PICU on-call room and was around to make sure things went smoothly.
Very exciting, very exciting. It's finally happening, you know, it's reality.
I was happy to say that I was completely irrelevant and not needed because things went really smoothly.
Right now the streets are clear, the team is in place, the hospital is shiny, and the kids are going to be moving in just a few minutes.
I'll be going over with the second patient from Potter 2 to Children's 5.
What we decided to do was to have the kid do it in a sense of a parade. And we had some of our artists who were musicians and puppeteers and whoever did great things for the kids on a regular basis participate in that, and it became a parade.
When we were transporting the children down the corridors, there was people lined up in a row, you know, just standing, watching everybody, you know, as it was going by.
I just remember there being a parade of kids on stretchers and in wheelchairs and trying to figure out what's going to be the best route of travel.
A safe route, yeah.
We did have people at elevators in the Potter building, elevators in the main building, elevators in the new children's hospital, and the communication was just incredible. And the atmosphere was just so much fun.
And there was music and laughing and singing, and it was a procession parade over at Hasbro, so it was exciting.
It's a little sad, but I'm very happy.
And the kids got teddy bears, I believe.
Every child leaving Potter building has a memento.
All in all, everything worked out very well.
Ready for the party? Ready?
It was like going from Kansas into Oz. It really was. It was colorful, it was so kid-friendly, just so much more space.
It was like walking into like Cinderella's castle of a hospital. And I remember the kids just thinking, I have my own bathroom.
It was so nice. I mean, people, from the infectious disease point of view, I'm an infectious disease physician, it was wonderful. All of a sudden we were able to put children in private rooms and keep, you know, children who had infections away from other children.
This whole project has been exciting, but this is the most exciting day of the project. To see the patients here, to be able to walk around, talk to them and their families and parents, it's one of the most exhilarating days in anybody in healthcare's life. It's outstanding.
When we opened the new building, it gave us an opportunity to have a place that we could call our own. We had worked out of previously the Dayville building in the emergency department, a small nook in that area, which we had very fond memories of, but in retrospect really was inadequate for the number of patients that we saw, the kids and their families. People sometimes think that, you need less space for children, but children always come with their parents and sometimes with their sisters and brothers, and we really needed the space that the new hospital afforded.
The focus of the building was on the child and family. So when they came in through that front door, there was a gift shop, there was a reception desk, there was the fountain downstairs and the fish tank that was also an attraction for families.
It was bright, it was light, the windows opened from every room. It was really fantastic. In addition, the artwork that was available at the hospital really lent itself to, if not a festive atmosphere, one that was really centered on a positive outlook, and that was really helpful, both for the families and I can't say enough for the staff who took care of those kids.
The entire building was just beautiful. And if you had to be sick, it was the place to go. For me personally, I had 2 babies at that time, so it was even more exciting for me to know that this beautiful building was going to take care of my children if I needed that.
One of the things I remember about the building, the tiles that all of the kids did in the community and how that lined the hallways. And you would see for many years families coming in, I know the tile is here, let's see if we can find it. So that was very exciting. All the new furniture that came in, the sleep chairs for the families so that they could stay with the children, I think that really made a big difference in having the room for the family to sleep over.
The benefits of the space, number one, was because the families were able to be with their child. That was a real big benefit. We also, I think, attracted a lot of new physicians that came to Hasbro that wouldn't have probably come before.
I had a few different job offers coming out of fellowship, and I chose to come to Rhode Island Hospital in part because I knew they were building a new children's hospital.
I hope that we can continue to be the beacon for children's health care for the Rhode Island area. We have wonderful physicians here and people who truly care about taking care of patients.
We would love to have a state full of healthy children. We know that Hasbro will always have the very, very important role of being there for the sickest kids or the kids who come in through the emergency who have major health issues. But at the same time, I think we need to take a more active role in the prevention and in the maintenance of children in the community.
That was probably the single most exciting day that I had at Rhode Island Hospital. I've been here for 38 years. To watch everybody in action and just to move these children from a building that was so small and so compact to this gorgeous new place that they were going to be taken care of in.
It really was a project that epitomized Rhode Island, right? Rhode Islanders are in Rhode Island, for Rhode Island, by Rhode Island, and it shows in that building.
To see the people come in wide-eyed, excited that this was their hospital, and to realize that we had both shared the same pride with them, but also had the responsibility of taking care of their kids. That was a big moment, I think, when we opened a children's hospital here in Rhode Island. That was a big first moment for us.